So what we've done here so far is with a collaborative effort amongst our team and physicians and dispatchers. And we've identified just having a designated COVID transport aircraft. With that, we have a high-level disinfectant process that we've came up with. It includes viricide as well as UV light. It's a newer product for us. They have used it in the hospital for disinfectant and sanitizing rooms, mainly in the ORs and then some of the in-house patients. So what it does, it produces UVC, which helps denature some of the bacteria, viruses, whatever contaminants in there, and renders it where it can't replicate itself and therefore dies.
For a long time, we've been flying highly infectious disease patients. When you talk about patients that have things like tuberculosis and other things like that are airborne diseases. But COVID-19 kind of brought to life that we didn't necessarily have a great guideline in place for keeping our employees safe and our flight crews safe when transporting these patients. And so in developing this protocol, we wanted to make sure we were still providing the highest level of pre-hospital care to the greater Houston area. So we have kind of stripped down the aircraft to make sure we weren't contaminating things that didn't need to be contaminated. But in this process, we're still able to care for the sickest of the sick.
With the Memorial Hermann Life Flight, we are here for the community as well as our system. So we're here to serve, to help any way we can.